Hi, I'm Dr.Navdeep. Today I'd like to talk about handling the emotional stress of IVF. By the time a doctor recommends an IVF, you likely already experience years of stress and anxiety that often accompanies infertility. So these feelings can magnify with IVF. IVF can be emotionally, physically and financially exhausting experience. In fact, many patients rated that undergoing IVF is the most stressful event of their life. The medication side effects, money worries and uncertain outcomes all contribute to the anxiety. Acknowledging potential stress points you may encounter along the IVF procedure and how to respond to them may help you go through the roller coaster ride associated with IVF. Firstly, prepare for your IVF. The medications and the side effects can make you feel unsettled and make the existing anxiety, depression and stress worse. Even going down to the hospital or the clinic may disrupt your family, work and social activities. As you physically prepare to start your IVF cycle, remember to emotionally prepare. Firstly, gather information. Google, speak to a friend or colleague who have undergone the procedure, or a fertility counselor. I believe that one of the best antidotes for anxiety is information and knowledge. It helps you prepare for decision making. When you read more, you can anticipate the decisions that you may have to make during your IVF. An example would be how many embryos you would like to transfer. 1, 2. The next would be sure that you're in a good place emotionally, that you have a good relationship, that you and your partner understand each other regarding the whole process and your expectations too. Consider joining an IVF support group because everyone there has either gone through it or currently undergoing it, and they would be able to explain certain aspects of the treatment to you. Next would be make your life as simple as possible. Avoid any major decisions, life-changing or high-stress work and family situations. Have a plan for what helps you relax. Consider mindfulness, meditation, deep breathing and yoga. Waiting to hear the news about your IVF cycle can be exhausting. The 2-week wait can be tiring. It's normal that you want to monitor your body every day for signs of pregnancy during this. You should balance the anxiety by preparing a few things. 1. Relax, treat yourself. Be intentional about doing things that you enjoy. Take slow deep breaths when you feel anxious. Think positively. Reframe negative thoughts. Expecting the worst can make the wait even more stressful. You and your partner should also identify stresses and coping mechanisms, which you both should discuss with each other. And that way, you can reduce those stresses. There are possibilities of failure at every step of the cycle. And acknowledge that you have control over certain things that you don't. Implantation is something that most of us have no control. So we always hope for the best. Despite significant medical advancement, an IVF cycle may fail. The important issue is recognizing that you have succeeded in doing all that you can within your power to have a child. To protect yourself emotionally, consider a few tips. Limit the number of people you tell about the IVF cycle. You also can assign a friend or a family member to relay your news for you. Plan where you want to be when you receive the news. May or may not want to be around certain people during this time. The other important issue is that discuss with your partner on how to support each other if the news is bad. Finally, don't plan any potentially stressful event around the time you expect to receive the news. At any time during your IVF cycle, if you develop uncomfortable anxiety or depression symptoms, you should consult with your doctor and he'll be able to help you to go through it.